Welcome back to Silvia's Health Hints. My collaborator behind the camera makes me laugh. Okay, but laughing is also healthy. Good. Today I want to talk about telemedicine. I want to talk about telemedicine because I think it's a convenient supplement to the traditional visit in the doctor's office. I do a lot of telemedicine. Many of my patients use video consultations alternating to in-person visits. Nowadays, the expression, the word telemedicine can mean a lot of different things. I won't only talk about video consultations between patient and doctor. What are the main benefits? The main benefits are, first, time saving. You don't need to go to the doctor's office. You don't need to take the bus, the taxi, the bike in a busy traffic. You save a lot of money, a lot of time. Maybe also money when you don't take the taxi. The comfort. You can make the consultation the comfort of your home. He makes me laugh. Okay. Okay, but it's okay. I'm sorry. Excuse me. The comfort of your home or your hotel. This is especially when you don't feel good, you are sick. It's very nice. The costs. Very often video consultations, telehealth services are offered with lower costs by companies who offer only telemedicine. I personally see a little bit a problem in all this because very often they offer short, quick consultations with also lower quality. This can be good if you want only a refill prescription, if it's some cold or not a big problem, but if you have more complex problems, I think that a video consultation would be done at least as accurate as an in-person appointment. For the doctor, it's even more difficult because he needs to make maybe more questions and compensate the fact that he cannot touch the patient. My video consultations had exactly the same, at least the same time as in-person visits and the same cost. Another benefit is that you can get in touch with your doctor from anywhere. For example, if you're on holidays or on a business trip, you don't need to search for another doctor, but can contact the doctor you already know and the doctor who already knows you and your health conditions. What can be done with a telemedicine consultation, with a video consultation? I think any medical issue that doesn't require a direct contact between a doctor and the patient, like injections, vaccinations, surgery, can be discussed in a video consultation. It is also suitable for pediatric consultations. I do a lot of pediatric consultations by video. There are a lot of, a doctor who is experienced in telemedicine has skills and learned how to compensate that he cannot visit and the patient directly cannot touch him. For example, we can tell, we take an example, a child with abdominal pain, and there's normally with a child there's always the mother or the father, someone from the family, so we can teach the other person how to touch, where to touch, to what to pay attention. We can watch it, we can control it, you can make a little bit of supervision, and a lot of things are possible to diagnose also in video consultation. Second opinion, this is also something, and discussion of results. This is something I do very often, that the patient comes to my office, we make a consultation, we take blood, and then when we have the results, the patient doesn't need to come again to my office, but we can discuss the results in the video consultation. What is important? There are some things that are important and that I see a lot also with my patients. For example, a quiet place. A quiet place where the patient feels comfortable, has his privacy, and is not disturbed by other rumors or other persons. To be honest, I have a lot of patients. I say hello to all my patients I like so much, who contact me, who connect with me to the video consultation in the middle of the center of Florence. This is not like it should be, but I mean, if a problem is not very serious, it works sometimes also like this. We did it many times, my patients know it. A good internet connection, it's very important because the quality of the video should be good. Good camera, because the doctor needs to judge the health conditions of a patient, he needs to have a good video. The picture needs to be good. Especially when, for example, it's a skin rash or something. And enough time, really. Even if you want to do it in the middle of a city center, but you cannot be in rush. Really, a consultation requires the same time like when you go to the office. So I want to say to all my patients that really take the same time for a video consultation as when you come here and sit and you have your 30 minutes. Now I come to telemedicine in Italy. I mean, in Italy, telemedicine is still not very common. Some providers who work with foreign patients, they offer also video consultations or only video consultations. Unfortunately, many of these services, like already mentioned, are fast consultations, like 5 minutes consultations with lower cost, but also with lower quality. It is also a big difference when you think about telemedicine, if it's a doctor who has his office and offers also additionally video consultations, then you know who is the doctor. Maybe you already know the doctor and the doctor knows you. As when it is a company with a lot of doctors, and when you call you don't know who will answer, or every time you call it's a different doctor, a little bit like a call center. This is not very, I wouldn't like it if I would be a patient. In Italy, unfortunately, a lot of doctors still do, even companies do it, video consultations using Skype, Zoom, or even WhatsApp or FaceTime. These technologies don't satisfy the data protection requirements and in reality are also illegal. As in Italy, but the main problem about telemedicine in Italy is the problem with the prescriptions. Officially, pharmacies can ask for an original printed paper prescription. Not a printed, but an original prescription with the original signature of the doctor. This is not because that the pharmacies are not nice and they want to do some create you difficulty. No, they have the right to ask for the original prescription. So this is something you need to know, and we have also, I already discussed this in a previous video about prescriptions in Italy. When you ask for a video consultation, when you book a video consultation with some company, you need to check before what kind of prescription you ask for, because very often they don't care. During my Christmas holidays, I had a case. I was in Greece, and in Greece I did, because I was not in Florence, I did only video consultations. A patient I didn't know, he called me and he was really desperate. He said that he already spent 200 euro in video consultations, I think with 3 or 4 companies, and to get prescriptions, and no of these prescriptions was accepted in the pharmacy. And when he told me, I asked him before I did the appointment with him, I asked him for what he needs really this prescription, you know. And it was a drug which required really an original prescription. So this is something that is not serious, and it's not nice to take money from a patient and do a video consultation to then send an electronic document which a doctor should know that won't be accepted. So these are all things to a serious telemedicine provider clears these things before. In my case, it's a little bit different because I am in office. You can also come, for example, you can come later and pick up the prescription, or if it's in Florence, where I have my office and I live, I know the pharmacies, and sometimes I bring the original prescription to the pharmacy. So in any case, I make a guarantee and I make sure that you really get your prescription filled in the pharmacy. Good. This is the main problem about telemedicine in Italy, the technology they use, and the fact of the prescription. So always, maybe when you book the appointment, tell before what you want. So, I mean, at least I would avoid that you make an appointment you pay for and it will be for nothing. Good, this is about, but for the rest, I think that telemedicine is really a good supplement, really, especially when you are very busy, when you don't have the time, or when you want to reach the doctor while you are in holidays or the doctor is on holidays. I think it's a good thing. So I hope I will continue to make telemedicine with my patients, even if in the middle of the city center. And that's all for today. I thank you for watching this video and wish you a very nice weekend, and see you the next time. Thank you.